Okay, in terms of nursing specialization in the Pacific, we have been working very closely with the South Pacific Chief Nursing Alliance, who have been very supportive of nursing specialization in the Pacific, and they have been very supportive in assisting Fiji in the development of our nursing specialization framework. So our framework is still in a draft phase, but we've developed our framework a lot. It's almost reaching completion. And the purpose of our framework is really to look at what clinical specialization should look like in Fiji. And it looks also at the career pathway for clinical specialization, which we have started in a small way. So we've started that in a small way, and our framework looks at the pathway to from a registered nurse to a clinical nurse specialist, a clinical nurse consultant to a nurse practitioner level. We haven't faced any challenges as yet. It's developing the process and getting the nurses together. So what we've had to do is get nurses from all the different areas of specialization to identify the levels. First of all, we had to identify the qualifications necessary for each of these levels. We've also had to look at competency standards for each of these levels. And just recently, we've drafted a draft scope of practice against each level. And so what we are going to do in terms of the way forward is, once we have our framework completed, we will take that to the council. We'll take that to the council because our recommendation to the Fiji Nursing Council will be to endorse or accept the generic levels of our career pathway in terms of the competencies, generic competencies for each level, and generic scopes of practice. So we hope that after the council endorses this, that the specialties, like for example the specialization for perioperative nursing, can then use those generic competencies and scopes of practice to develop their own scope of practice for their area of specialization. So at the end of the day, our expectation is that this becomes the standard framework, and all other specializations take this document and use it to develop their own area for specialty. Yeah. I think the value is the great network that we have with the meeting, and getting everyone together in one room from around the region. We can share, we also can see what countries are having in their own, for example, the support by the NZMTS program, for example, the work that they're doing in Tonga and the other countries like Samoa and Vanuatu. And what we've done in Fiji, we've developed the child health curriculum, and so now we know that Tonga is interested, and we hope to have Tonga participate and share the curriculum with them. So it's about getting the countries together and using the networks to further develop clinical specialization in the region.